AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher. We have a guest in studio from Central District Health Department. The Health Projects Manager Fernando Sanchez is back to chat with us about an important project that you have going on. First, welcome back.
That's right. Thank you so much for having us again.
You're working on something specifically aimed at youth, and I know this is near and dear to your heart.
Yes, it is. Yeah. I've always been just a big advocate for youth. I mean, I'm also a big brother, big sister. I've coached middle school soccer. And so when we had this opportunity to have this as one of our projects, I was really excited about it.
So we're going to talk about opioid prevention efforts, and especially for young people, this is vital.
Yes. Yeah, so we received the grant not too long ago, and so we were just finishing up planning on how we were going to do this. And so honestly, thanks to the support that I had from Carly on how we were going to go about it, we're really excited about it. And so what it's going to look like once we're starting to get those youth involved, it'll be starting next year. And so we're going to start recruiting these youth. And so by youth, we're looking for like 12 to 18-year-olds. And so we're trying to make as big of an impact as we can, because with us serving the Central District, that entails Hamilton, Merrick, and Hall County.
So you have a chance to talk to a lot of kids.
Potentially, yeah. So that's going to be the plan. And so what I'm really excited about is I'm going to be forming a youth advisory board from this. And so I want as much like representation from the various school districts in Central District as possible.
Have you laid out an outline for the actual implementation of the program, or is that something you want to involve this youth board with?
So I have, I do have an outline laid out. So the way it's going to work out is going to be structured in the sense that we're going to meet on a regular basis, and I'm going to break them off into committees. And so that way, because I'm just there more so to facilitate and give direction every now and then, because ultimately they're the ones leading this project. And so I'm going to break them down into, they're going to be a marketing committee, event planning committee, peer support, and our data and research committee.
So about how many members are you thinking that you're going to be able to keep engaged?
So I think I don't want to do it too big, because I think it can get a little challenging. So I think I'm looking for about 8 to 10. I think that's like a pretty good number. And I think again we'll just kind of reevaluate just once we have like our first meeting, because the first meeting will really just be like, what do they want out of it, and see what they want to do with it.
Sounds like you put a lot of thought into this, because you're right. If it gets too big, it can get out of hand, because the discussions never end.
That's right. Yeah, and I know they have tight schedules too, so I need to work around their schedules as well, because most of them they're going to be in high school or maybe some middle schoolers, and so I know some of them are going to have to work as well, so I need to work around that and be mindful of that. But I do have incentives as well to compensate them for their time. So we've set up this cool point system to reward them, and then they can cash in their points for rewards that we have, and so we'll have just a various amounts of gift cards, swag, and just other stuff to give them.
Wow, you have put a lot of thought into this already. I can see.
Yeah.
That's what he wants to share. So do you have a formal name? Is it the Youth Opioid Prevention Project? I mean, are you going to come up with a name, or is that to be determined?
So that's going to be determined by our marketing committee. So that's just a generic Youth Opioid Program at the moment. But in the next few months, because I want to be able to give them swag that has our logo and name, and so that's going to be our marketing committee that's going to help us create that logo and that name.
The idea, of course, is to prevent the incorrect use of opioids. There are some of those medicines that, when used properly, can make a difference, but if they are misused, they can become addictive and can become very problematic.
Very true. Yeah, I've had a lot of good support from some of our community partners, and that's what I've heard from them. And more than anything, it's a space for them now to advocate for themselves. Fernando
Sanchez is the Health Projects Manager at Central District Health Department. What's your realistic timetable now?
So we'll send out surveys to all the involved schools and organizations that have those youth that we would like to recruit starting beginning of next year. So I'm aiming for the first meeting with the youth around middle or end of next month.
Here it comes. I think it's going to be busy. I will be anxious to hear a progress report on this, because
of course,
it sounds huge. I look forward to it, though.
Thank you so much.
All right, Fernando Sanchez from Central District Health Department. Good morning from AM 1430 KRGI and 105.5 FM.